Hey everyone, Sarah Stackhouse here with Real News Communications Network. A few weeks ago, we were talking to you about strokes and kind of the recovery process with Dr. Johnson. Well, today we are here with Emily, who is a colleague of Dr. Johnson's, and we're talking a little bit about rehabilitative speech therapy and all that goes with it, the misconceptions, and really what people don't understand. Emily, thanks so much for joining us.
Sure, thank you for having me.
So tell us a little bit about what you do. You know, rehabilitative speech therapy. In theory, I think we can kind of understand what it is, but
right.
Tell us a little bit about what you do.
So speech therapy is it's kind of a broad umbrella. We can work with any number of individuals ranging from birth all the way through geriatrics.
Right.
We can work in any we can work in educational settings, hospital settings, rehab facilities. We can work in research. There's so many different. It's just the umbrella is so huge. Trying to narrow it down is very hard.
Sure.
So I particularly specialize in working with adults and adolescents who have had some sort of neurological deficit, either caused by stroke or traumatic brain injury. So I specifically, this is not specific at all, but so as a speech therapist working with adults, I can evaluate, diagnose, and treat, first of all, speech, language, swallowing, voice.
Swallowing?
Yes.
Wow.
Cognitive communication and social communication.
Oh, wow.
Disorders.
I would never think that, you think of swallowing as something that happens naturally,
right.
but tell me a little bit about what it's like to teach someone how to swallow.
It's very hard. So a lot of the time swallowing is, dysphagia is the term, and it's basically a swallowing disorder, and typically is caused by some sort of neurological incident, whether it's a fall or a brain injury or stroke, and this can cause problems just like you or I have probably had, where food feels like it goes down the wrong way, or liquid feels like it goes down the wrong way, or coughing or choking during meals. The only thing with somebody who has dysphagia or swallowing disorder is that this happens all the time.
Oh,
so
that must be the worst feeling.
It is. And so swallowing is basically controlled by nerves, and nerves are from the brain. So any sort of brain injury or fall or incident that would cause sort of neurological damage would cause issues with swallowing. So people can have swallowing problems with chewing, with holding food in their mouth because of their lips, and the nerves that feed their lips don't hold the water or liquid inside. Wow. Tongue movement is controlled by nerves as well, so moving that food to the back of the throat in order to swallow it. Also, the closure of your airway, because you have to close it. A lot of things happen all at once. So you're closing your airway.
This happens while I'm swallowing?
In a split second, yes.
Wow.
So the closure of your airway to allow the food to go down safely into the right passageway. Then food goes into the esophagus, and once it gets to the esophagus and starts traveling down, that's kind of where we stop. A GI doctor would take over from there.
Okay.
So there's lots of different ways you can assess swallowing. You can do a bedside swallow evaluation, which is basically at bedside you're giving different foods, different textures of foods to eat and drink to see how they tolerate those consistencies. Or also you can do what's called a modified barium swallow study, or an MBS, or a swallow x-ray also, so that they are taken to a radiology suite and actually turned sideways, and you give them the food and drinks, the different textures and different consistencies to eat and drink, and then the x-ray machine can see how that food is passing and how the liquids are passing and how they're controlling it. Then, based on how that goes, you can treat in various ways.
And this is just one aspect of the speech therapy that you're doing. So tell me a little bit about when people actually come to see you. When should they come see you, and how can family really help in that regard?
Sure. A lot of what I enjoy working with and have had many years experience working with is people who've had strokes. Strokes, depending on where they occur and the type of stroke, can cause different difficulties depending on where in the brain it's been affected. So no two strokes are the same. Most commonly, those strokes occur on I'm sorry, let me back up. So the most common type of stroke is an ischemic stroke, which is caused by a blood clot, which means that there's no oxygen or blood getting to certain parts of the brain. The most common vessel for that to happen in is called the middle cerebral artery, and that's an area that specifically leads to areas like speech and language, So that's
why it's so common that something like that, that's why you're so necessary.
Right. Sure. So when somebody has a stroke, let's say they have a stroke on the left side of their brain, they typically present with either decreased sensory or decreased movement or lack of movement on the right side of the body. Their face, they may not be able to smile, so the muscles in their face may not be working correctly. And they also, if they have a stroke, for example, on the left side of the brain, they typically have issues with language. Okay. So then language is also broken down into reading and writing and speaking and listening.
Wow. I feel like that list just keeps going, and you would never assume that.
It's like an accordion that just keeps opening up with more information. So expressive and receptive language is one area that I really enjoy working with. And another term for that, when people have difficulty with language, is called aphasia. Okay. So aphasia is basically just a disorder of language. You can have issues with receptive language, so how information comes in, how you're hearing and listening to the information, how you're seeing or reading the information, and then expressively, your ability to communicate verbally or through written communication. Wow.
So is this, I don't know, my head kind of went to like dyslexia.
Right.
Is that a form of aphasia? Am I saying it correctly?
It's not. It's actually, they're related because they're both language disorders, but dyslexia is a learning disability, something that is from birth. That you have developed, and that's you're having issues with decoding and reading.
It's not necessarily from like some sort of a head trauma or something like that.
If you have a stroke or a traumatic brain injury and end up with issues related to reading, then that is called aphasia. Okay. So one is developmental, one is acquired.
I see. Okay. So what are kind of, maybe one of your favorites that you were saying that you really enjoy, what is the process for really breaking it down for someone and trying to help them get to some sort of progress?
Sure. So when somebody comes in for, if I get a referral from a doctor and they come in to see me, and let's say they've had a recent stroke on the left side of the brain, most typically I'm going to assess all the different areas that I mentioned. I'm going to assess voice and breathing and their speech, their language, their ability to understand and communicate language. I'll assess swallowing and social language skills as well. Wow. And then based on all that information, I'll develop a plan of care. Sometimes people have difficulty for, I'll just use one patient that I can think of off the top of my head who has aphasia. Mm-hmm. With him right now, what I'm working on is his ability to communicate. So he can communicate at a functional level. So he can basically get across his wants, his needs. He can speak, to his family and communicate, small items to them. But being able to communicate in longer sentences, be able to go back to work and communicate in conversation has not happened yet.
So is it the physical, is it the problems with physically moving his mouth, or is it more of like a connecting the dots in the brain?
It's both. So aphasia does not impact intelligence whatsoever. Oh. All the thoughts and words and ideas are still there. It's just the ability to access that information. Wow. So when I have a patient, I compare it to, like a locked box of words and phrases and thoughts and feelings. And you have a set of keys that used to work. Yeah. You didn't really have to think about it. It just all came out whenever you wanted to communicate. Now, when somebody has had a stroke or has aphasia, it's learning to use a new set of keys to unlock those words.
What a frustrating concept.
Right. But here's the hard part, is that the keys don't always work the same. So you have to have a set of keys. That sometimes, if you're having a bad day, maybe use certain strategies to come up with the words that you're wanting to come up with. Or on another day when things are coming better, but maybe it's so hard to describe somebody with aphasia. So it's like the words are locked in there and they just can't get them to come out.
It sounds like, a really difficult process. How can family, friends, someone who knows someone with aphasia, how can they really help and make sure that they're there for the person, and how important is that support?
That's a good question. So in my experience working with lots of patients in a variety of settings and with various degrees of difficulties, the number one thing that I find really helps patients improve is family support. Having kids or siblings or spouse or parents that are there to really support you and take you to therapy and pick you up and ask you how you're doing and also help with you at home. The therapy doesn't just stop in the therapy room. You need to continue practicing and doing all those activities at home. So if somebody is alone, or they're divorced, or if they don't have children, or they just don't have that family support, it's so hard to find that internal motivation. So families, a lot of times, that's a really common question, is how do I communicate with somebody who has aphasia? And it's difficult. I mean, as a therapist, I still have difficulty communicating. One really important thing is just to get rid of all external distractions. So turn off TVs, turn off phones, turn off radios, things that can cause all that extra, that added kind of noise stuff, the noise that we hear all the time. So eliminating all that so that the patient or the client has just that one task to focus on, is talking to you and listening to you, and also getting their thoughts across. That's great. Another thing is, don't finish sentences for them. So a lot of the times, like maybe, for example, you've run across somebody who stutters. They're working on getting a point across to you, and then you just fill in the blank. But it's always best to let them do that.
I feel like I do that all the time to my family, or I jump in, or oh my goodness.
It's hard. It's very hard. You have to make yourself not fill in those blanks for them. So when people have difficulty coming up with a word, or they're pointing to something and they what it is, instead of just saying the word for them, cue them to it. And that's a lot of what we do. There's a whole hierarchy of cues that we use to facilitate the language. So we'll start out with the lowest level of cueing, and if that doesn't work, we'll move up to the next level, and then let them be successful with getting those words out when they can. Another good,
that's such good advice, though,
so
because
tips,
I would think that, I'll help the person, I'll finish their sentence, or I'll help the person and I'll just say what it is they're pointing at so that they can remember. But I would never think to let them make sure that they finish their own sentence. That's interesting. What are some of the other common questions that you really get a lot? Or I guess the one that people might not understand the most.
I think because coming out of school, knowing that I wanted to work as a speech therapist, the majority of therapists are wanting to work with children. And so there's not a lot of therapists out there working with strictly adults. There's a lot of mixed practices where they specialize in kids, but they also see adults if they come along. So that's why I wanted to start my private practice, because I knew there was a need out there for just adults needing speech therapy.
That's great.
A lot of the times, after you've had a stroke or brain injury, a traumatic brain injury, you need physical therapy and occupational therapy, and there's a lot of rehab facilities that offer all three of those, in addition to counseling and education, all the other therapies that are provided. But for me, I really like working with the patients who have, like I said, aphasia. So a lot of the times they don't have as many, or they've kind of overcome the physical aspects and aren't needing a lot of physical and occupational therapy any longer. So there's just not a lot of people out there that you can just go get speech therapy.
That's interesting.
Yeah, so that's why I get a lot of phone calls. Can you treat my daughter who just has a diagnosis of dyslexia, or can you treat my son who's just diagnosed with autism? And I am qualified to do that. However, I do not have the experience in my career. So there's a lot of great therapists out there, and I'm great at referring people to good children's speech.
If someone is watching this and they're like, oh my gosh, that is what I need. That's what I've been needing. That's what my brother needs, my mom, my dad, whoever needs. How can they contact you? How can they find out more information?
Sure. So my business is Mend Speech Therapy. I'm kind of a word nerd, so the word mend means a lot in the rehabilitative process. So mendspeechtherapy.com, or you can email me directly at emily@mendspeechtherapy.com, or my phone number is 972-729-9083.
And tell us a little bit about how you've kind of connected with Dr. Johnson. Hyperbaric Chambers, help with a lot with recovery, and you're a huge, portion communicating with someone. It's a huge deal. That's how we connect. So something like that is so important.
I met Dr. Johnson last year, last summer. He had a patient that was coming in who just recently had a stroke and was coming in for the hyperbaric chamber treatments for his stroke. He also had very severe aphasia and apraxia, which I haven't even gone into. But anyway, so he had two severe things going on. He just had his stroke, I think, within the week. And somebody reached out to me and asked if I could come here to the facility, to his office, to treat this patient. So he would do hyperbaric treatments 1 hour, and then I would see him for an hour, and then he would go back into the chambers for another hour. So he was getting very intensive therapy, both from Dr. Johnson and from myself. So I was seeing him about 5 times a week initially. And then I just casually asked Dr. Johnson if he had some space to lease, and he's so
well, it's perfect that you're here. It's kind of a one-stop shop now.
Yeah, exactly.
That's wonderful. One more time, that phone number and your website.
Sure. It's mendspeechtherapy.com.
Like MEND?
MEND, yes. And the phone number is 972-729-9083.
Well, Emily, thank you so much for joining us. I know it was so interesting, and a lot of stuff that I really didn't realize all went into this, and I know a lot of people as well.
For days.
Yeah.
Any number of things. Yeah.
Wonderful. Well, thank you so much.
Thank you.
Yeah. All right. Well, we'll be right back.